A registered nurse is caring for a client with acute pancreatitis. Which of the following physical exam findings are associated with this condition? Select all that apply. 1. Cullen sign. 2. Gray-Turner sign. 3. Koenig sign. 4. Murphy sign. Or 5. Rovsing sign. So let's do a quick refresher. What is acute pancreatitis? You've got it. It is that sudden inflammation of the pancreas, and it causes really severe abdominal pain. There are many different causes of this condition, such as gallstones or even excessive alcohol use, certain medications, or even high triglyceride levels. So let's go ahead and work through these one by one, and we're actually going to start backwards. So let's start with number 5, Rovsing sign. Is this associated with acute pancreatitis? No, it is not. It is associated with acute appendicitis. And this is elicited when pressure on the left lower quadrant of the abdomen causes pain in the right lower quadrant. So we can go ahead and rule that one out. Now let's look at number 4, Murphy sign. Is that associated with acute pancreatitis? No, it is not. It is indicative of acute cholecystitis or inflammation of the gallbladder. And do you remember how this physical exam finding is performed? So yes, Murphy sign is elicited when you ask the patient to take a deep breath, and as the examiner, you will hook your fingers under the right costal margin, and a positive Murphy sign would be when the patient abruptly stops breathing due to that intense pain. Okay, let's go ahead and move on to number 3, Koenig sign. So is Koenig sign associated with acute pancreatitis? No, you got it. Koenig sign is associated with meningitis. And just as a refresher here, this is that physical exam finding when the patient will experience stiffness and resistance to extending their knee when their hip is flexed at 90 degrees. So we can roll this one out. Now let's go ahead and look at number 2, Gray-Turner sign. Do you remember what this is? You've got it. Gray-Turner sign is that appearance of the bluish discoloration along the flanks, and it is indicative of intra-abdominal bleeding. I always think if you turn the patient over on the side, you will see Gray-Turner sign. And yes, this can occur with acute pancreatitis, and it is an emergency. Now, looking at number 1, Cullen sign, do you remember what this is? You've got it. This is blood in the peritoneal cavity, which can occur in severe cases of acute pancreatitis. Cullen sign occurs around the umbilicus or around the belly button area, and I always think that is the center of your abdomen. And Cullen and center both start with the letter C, so that's an easy way to remember this. So looking at our answer choices, we know that options 1, Cullen sign, and option 2, Gray-Turner sign, are indicative of acute pancreatitis. Great job, everybody.